So we are live in 5, 4, 3, 2, 1. We are live now.
Good evening and warm welcome to the third session of Healthy Life Initiative of OrthoTV. I am Dr. Mahek Lokhandwala, an orthopedic surgeon practicing in Ahmedabad, and I am going to be one of the hosts of this session. The first question, like why OrthoTV decided to start this program or this special program. The reason is, according to one recent study of USA, 88% of the adults are not metabolically healthy. If you look at other way, only 12% of the adult population is metabolically healthy. This is really a shocking study, and there are many reasons for that. But the most important question, which I always like to ask, that we say that science, medical science is progressing so fast, and then why we are not able to maintain our health. The Healthy Life Initiative webinars try to look at the health from a very comprehensive aspect. So we are not only looking at one part of the healthy life, we are looking the healthy life as a whole. And so we had a first webinar in which we discuss why we are becoming obese. In the second webinar, we discuss about intermittent fasting. And in this webinar, we are going to discuss about the low carb diet. You will be surprised that there are 40,000 books on Amazon on the top, who is very popular podcast, and recently is published the book, which is called Outlive. In he mentioned that we know a very less about diet and nutrition. And if we compare, then the knowledge of subatomic particles is much more on the with the science. And that is really true. And that also says that why we are not metabolically healthy. Just a minute, let me do this first. So there are various types of the diet, starting from the low fat, keto diet, vegan, carnivore, paleo, Atkins, and every diet has a strong supporter. And on the other end, there is people who are strongly supporting that views related to that particular diet. The most important thing is, like, there is no conclusive evidence with us, but still people are strongly recommending one or the other diet. So we hope that in this webinar, we will try to bring more clarity about low carb diet. We are very fortunate to have Mahek Lokhandwala, who is a life coach practicing in Mumbai. The best part about Mahek is that whatever she's going to share with us, she has already applied on herself and on the family members. And so whatever knowledge she's going to share is a practical knowledge, a time-tested knowledge. We are very fortunate to have a second special person with us, Dr. Karnav Desai, who is a practicing pediatrician in Ahmedabad and is practicing pediatrics for last 33 years. He is also a strong like having a very good interest in nutrition and diet, and his YouTube talk on how I brought my diabetes to remission is very popular, and a lot of people have found it very useful to control their diabetes and to stop their medicine completely. Before we go to the actual webinar, let me say that the information which we are going to provide in this webinar is only for the educational purpose. It is not intended to substitute the professional medical advice. The viewer should always consult his or her healthcare provider to understand and to apply this knowledge. And whatever their healthcare provider suggests is going to be the important decision for them. The listening to the session does not constitute a doctor-patient relationship. The speakers, the host, and the OrthoTV disclaim responsibility for any adverse effect that may arise from following the advice in this session. So initially, we will have a few questions and there will be an interaction amongst the faculty. If you have any question, particularly those people who are viewing this session live streaming, for that, I am suggesting that please note down a number. That's a WhatsApp number. You can ask your question on that number. So please note down that number. It's 97129 25600. I'm repeating 97129 25600. So if you have any question, please feel free to ask that question. So now we are starting the session. And the first question I would like to ask Mahek is, can you please tell us about your background, briefly about yourself, and how you came into this field of nutrition, diet, and guiding people about nutrition?
So thank you very much for such a lovely, warm welcome. And thank you to all the faculties who are present here and who are welcoming me here. Me, Mahek Lokhandwala, age 47. I reside in Mumbai along with my family, my husband, and my 15-year-old daughter. Nutrition has been something that's very, very close to my heart right now. Of course, keeping in mind the current situation of the country also. But if I had to take this a little in the past, by profession, I am a jewelry designer. I used to run a fashion jewelry store. And along with that, I've always been very passionate about being fit. So going to the gym, trying to get on to all those so-called healthy foods, yeah, like how everybody does. And in that pursuit, I've always tried and tested a lot of things, like you also mentioned, different diets. So anybody would come up to me with a new diet, I would try and do it. Until I realized that it just all failed. Because probably I was not coming to the crux of that diet. I was not trying to understand what that diet is going to do. So I was just doing it blindly. What made me come into this field? There are two reasons for that. Firstly, my mother's health, who has been a diabetic for almost 30 plus years. And the second reason I got into this was because of my own health, where I had just been introduced to intermittent fasting in the year 2018. And up until 2018, I was eating a regular conventional diet. So eating just the way a standard Indian plate is. One of my friends introduced me to intermittent fasting, and I was very excited about it. And I started doing it. So obviously started to include more of fats in my food, more of protein, cut off the carbohydrates, and so on. It went on for a couple of months until around 6 months post that lifestyle. Yes, of course, I lost a lot of weight also in those 6 months. But what happened was, in the month of March of 2019, I was due for a regular checkup. And in that checkup, all my markers turned out fantastic, within the range, except for one, which was my LDL cholesterol. So my LDL cholesterol cutoff was showing 150, and it turned out to be 163, to which the staff at the hospital, at the lab, assisted me to a cardiologist because they wanted me to see a cardiologist since my LDL was on the higher side. Up until then, I had no idea about nutrition. I had no idea about what a report looks like, how is it supposed to be read. Anyway, so the cardiologist was pretty upset, and he saw my reports and he was like, you have to cut off all the fats from your food. You shouldn't be doing intermittent fasting. It's very unhealthy. And I was very confused. I did not know what to do. So the next thing I asked him was, sir, what do you suggest that I should do? And he put me onto a statin, which was a cholesterol lowering drug. So, like, of course, we all go with the white coats. I did the same. I took up that drug and I started it. I saw very adverse effects from it in the coming months. I started to gain a lot of weight. I started to have a lot of fogginess in my brain fog. I could not see properly. I was having irregular menstrual cycles. So, ability. That's when I actually decided that I wanted to get deeper into nutrition, and I wanted to understand, why are we so succumbed to medicine? Why are we not taking things in our hand? Why are we not understanding lifestyle and nutrition? So that is actually what got me into this field of nutrition. And coming back to my mother, I'll add here, she is age 75. She's been a diabetic for almost 33 years. She's been taking diabetes medications along with eating the same lifestyle that she always has, that her parents have always had. And every time I look at her reports, they just turn out to be the same. Medicine dosages has been increased or decreased a little bit by a few points, but rest, everything remains the same. So while I was on my own journey of understanding nutrition after my cholesterol lowering drug event, I happened to ask her, I said, you keep going to the doctor over and over again, and she keeps giving you the same medication and she keeps giving you the same foods to eat. Why is there no progress? So you know how the old people are, they'll just shun you off, or you don't know anything and you haven't even studied half of what they know. So that is the time when I really wanted to dive deeper, and I started to do a lot of research on diabetes. I got my hands on my very first book called The Diabetes Code by Dr. Jason Fung. So this book actually gave me the insight to what exactly is diabetes and why India is at the threshold of, topping the numbers on diabetes today. That's how it all started.
Yeah, so that's really interesting that your personal problem or the abnormal report and your mother's problem that brought you to this understanding of low carb diet. So
Yes.
before we dive deep into the subject, let's have a clarity about the basics. So when we are talking of low carb diet, can you explain like how do we understand the low carb diet? Because various books have a different definition of that. And then there is one more thing in low carb diet, and that is keto diet, which is another extreme. So first of all, let's have our audience a clarity about what do we understand by low carb diet.
Absolutely. So when I say the word low carb, the word by itself is self-explanatory, right? Low carb simply means you are restricting or cutting your carbohydrate content in your plate relative to a standard diet. So foods which are very high in carbs are now replaced with fats and protein. So healthy fats and good quality protein, right? In terms of a vegetarian, the choices will be different. In terms of a non-vegetarian, of course, the choices are going to be different. But the concept still remains the same. You are lowering the quantity of your carbohydrate. Now, a low carb diet typically would restrict foods like your breads, sugar sweetened beverages, grains, yeah, any forms of sugar. While you are decreasing this quantity of carbohydrates on your plate, you have to increase your quantity and quality of the protein and the fat in order to keep you full, or you can say to keep you satiated for a longer period of time, right? So this is about low carb. Keto, on the other hand, is similar to low carb because even in a keto diet, you are cutting off the quantity of your carbohydrates. You're actually dropping the quantity to a very, very low carb. Keto is basically, or it was originally designed to treat epilepsy patients. And currently, there's a lot of research which is showing that keto is helping to impair cancer. Yeah, of course, there's a lot of research still going on in that. Keto diet, the main goal of a keto diet is a term called as nutritional ketosis. Now, what happens is in a nutritional ketosis state, the body is producing something called as ketones from the fat in your liver, and you're using that fat as fuel for energy. So you're basically replacing the sugar or the glucose now by using the fat as fuel for energy to run the system. Now, this is only going to happen in the absence of glucose. So a typical low carb diet would be anywhere between 50 to 100 grams of carbs on your plate, whilst a keto would be less than 50 grams of carbs on your plate. So more of increased protein and definitely a very high fat diet.
So let's understand slightly with more detail. Let's take a normal adult who is weighing 60 to 70 kilograms. Who is taking a 2000 calorie per day, consuming 2000 calorie per day. So of that, as I understand, the normal vegetarian person who is a Gujarati would be consuming around 70 or even more percentage of carbohydrate in the diet. So
Absolutely.
A large portion of calories are coming from carbs.
Yes.
On the other hand, we have a concept that we need to avoid fat. So we try to cut down the consumption of fat. And naturally, because a vegetarian person is having a problem of protein in the meal, except
Correct.
the milk or the legumes. So ultimately, we end up with around 70% of the carbs. So from that, how do you suggest, like, say, low carb diet is like taking to what level? To 55% to 45% of the total calories per day? Or
I would say 50%.
50%. So 1,000 calories is in the form of carbs. So that
Carbs.
comes to around 250 milligram of carbohydrate.
Yeah, maybe
total.
even less. Yeah. So if it's somebody who is a pure vegetarian, let's say, who does not take even eggs, so there is a lacto vegetarian, and there's vegetarians who don't even eat eggs. And I always say this: most vegetarians in India don't eat vegetables; they eat grains. So 90% of a vegetarian plate or a thali is full of grains. So if I had to advise a vegetarian person to go on low carb, removing the carbs instantly from the plate is not going to help, because that's going to keep him hungry, because there's no energy coming in, right? So giving them a better understanding of how to increase their fat content, because in the absence of carbohydrate, you are going to be using the fat as fuel. Now, also you have to understand that carbs is 4 calories per gram and fat on the plate. Another point which you just mentioned about is that most vegetarians are fearing fat. That is, we don't take enough fats on our plate because of the fear of cholesterol. Right? Now, that is a completely different chapter, because cholesterol is another molecule which is of such utmost importance in the body, without which there are so many functions that will be at a full stop. So consuming good amount of fats from the right sources will keep a vegetarian high on satiety and will always keep their blood sugars in control. See, 90% of the vegetarians which I get who come to consult me, and when I see their reports, is that the one common thing I see on their plate is sugar in every form, be it rice, roti, bread, sweets for that matter. Earlier, we always consumed sweets as on occasions. Today, we don't do that. We consume sweets on a daily basis. So the quantum of sugars that we are consuming today on our plate has gone way beyond the body can handle. So hence, yes, increasing your protein content is a very important factor. Another myth with protein is that it will lead to kidney damage. Absolutely not. Protein is an essential macronutrient, which means your body requires it and it can never make it for you. So you have to eat it from food.
Okay. The next question, we understood about the basic idea about the low carb diet. Now, the next question I would like to ask you is about what is the rationale, what is the scientific background of this diet? Do you have any idea, like, why does it work?
Yes, absolutely. It's very simple. Two things in a human body, essential and non-essential, right? So when we talk about essential, it simply means, like I mentioned, we require it, our body cannot produce it, and we cannot live without it. So in that category, we have proteins and we have fats, good fat. Okay. Coming to the non-essential, we have carbohydrates. But why would we call it non-essential? Simply because our body has the ability to produce its own glucose through a process called as gluconeogenesis, the making of new glucose or the formation of new glucose in the liver. Now, what is the rationale behind low carb and why does it work? Firstly, we have to understand and accept that we are on a very high carb diet, right? Our body has 5 liters of blood, to which it needs just 1 teaspoon of glucose, sugar, just one. And that is equivalent to 4 grams, which your body is very well capable of producing when it requires it. The way we eat today is nearly 700 grams of sugar on a standard Indian plate, way beyond what the body can handle. Hence, the body has to give you signs either in terms of weight gain or in terms of some kind of a metabolic issue. These are the signs that your body will constantly keep giving you, but we are constantly ignoring it. So why low carb really works here is when you are lowering the non-essential from your diet, you're basically telling your body that you can make the glucose as much as my body requires. I will not be giving it to you from my food. Whereas I will be supplying you the essential proteins, the essential fat, which are going to be which are going to help for building of structure, muscle building, and for fats, which are going to be used as energy. So the basic and the most fundamental rationale behind low carb diet is that it lowers your insulin, the hormone which shuttles the sugars into the cells when it is not in use. So every time this constant eating of carb-rich diet, sugary-rich foods is constantly increasing or spiking our blood sugar. And the main purpose of our body is to always keep our blood sugars in the normal range. So the body will do everything possible. And the most important thing that it does is that it will secrete insulin so that insulin can keep shuttling the sugar into a cell. But the point is, for how long? One fine day, that insulin also stops functioning. So that is the main reason where low carb comes into existence. Definitely for weight loss, yes. Of course, if you're going to reduce insulin, which is a fat storing hormone, an anabolic hormone, your body is going to start to use the stored fat in the absence of insulin. So that's the actual rationale behind a low carb diet.
Yeah, good.
It has also helped many diabetic patients simply because their blood sugars have come into control. Their hypoglycemia has been taken care of through it.
Okay, Pranav, can you continue the discussion?
Right. Great, Mahek. I came across this diabetes code and book by Robert Lustig also. And by advocating this low carbohydrate diet, I have, kept my diabetes in remission since about 6 months to 9 months. And I was not aggressive. You said 50 to 100 gram, but I calculated my carbohydrate. It was 130 gram, but below 130, I was not able to reduce it. So definitely there are indications for low carbohydrate diet in weight loss, as well as a good metabolic control and remission or reversal of diabetes, as you said. But what are the other benefits of low carbohydrate diet apart from these two major, that weight loss and metabolic health and diabetes remission? What are the other benefits?
The other benefits, like I said, was a low carb diet will be of great help to diabetics, firstly. Also in your cardiovascular issues, because the higher you're taking carbohydrates in your meals, and especially from the bad fats, from the trans fats, you're actually putting your heart at risk because of the cardiovascular disease, the bad cholesterol going up. So most of the people that I see who are on a vegetarian diet, come to me with very, very high inflammation, very high CRP markings, very high cholesterol levels, very high triglyceride levels. And one of the major reasons for this is seed oils, refined oils that they've been using, which is causing these inflammation. So a low carb diet will also help to reduce inflammation. It helps to make you insulin sensitive, most important, because without insulin sensitivity, your muscle cells are also not going to react. Your brain cells are not going to react. These are all going to start becoming resistant to insulin. So insulin sensitivity is one of the major good side effects of low carb diet.
Okay. In your clinical practice, how do you modify your strategy for different indications? Say every individual is different. One is obese but not having diabetes. One is obese as well as having diabetes. One is diabetic plus normal weight. So are you, recommending different protocols or different strategy for different persons?
Yes, sir. In some cases, I do. But the first marker that I need to see is your report. So everybody who comes to me, whether you are obese, whether you are diabetic and obese, the first judgment that I make for that person is through your reports, your fasting insulin, HbA1cs, and of course, after seeing their eating profile. So everybody is going to have a different eating profile. Now, there are many people who are diabetic, but they are not obese. Also, There are people who are toffee, so they are thin on the
Outside.
inside, outside, and they are fat on the inside. Now, these kind of patients, again, more dangerous because the fat is starting to collect on the organs.
Right. So
Right.
you said keto diet, less than 50 gram of carbohydrate.
Yes.
Is there any specific indication of keto diet you are recommending? I mean, if patient is resistant to weight loss, then you recommend them keto diet, or what are the specific indications for recommending keto diet?
Not as such, sir, because I would recommend a keto diet to an obese patient, and I would recommend a keto diet to a diabetic also. But of course, the procedure would be a little different for both, because when we are dealing with diabetics, you have to also understand if they are on medications, how their blood sugars are reacting. Only then do you get into a keto diet. So keto diet, like I mentioned, is more of high fat and moderate protein with under 50 grams of carbs. Now, the problem for today with keto diet is that a lot of different people have come up with their own versions of keto diet. So a lot of packaged foods today are being sold as keto products, which are more dangerous. So when I have to recommend somebody a keto diet, I always tell them two simple things: eat only when hungry and eat until you're full.
Okay. But if person is on keto diet for a longer period, I mean, persons with comorbid condition, is there any chances of developing ketoacidosis clinically?
No, sir, there is no such until and unless your insulin drops off completely. That's in the case of a type 1 diabetic. So in a nutritional ketosis, no.
No. Okay.
Not.
Good. And one more question regarding my personal experience.
Yes.
Just a minute. By advocating low carbohydrate diet, I have reduced the weight quite a lot, 4 to 5 kg. So without now increasing my blood sugar or glycemic control, I am not able to increase my weight. What should I do?
Increase protein.
Increase protein.
Yes.
At what percentage you
train.
recommend? What percentage of protein you normally recommend up to the safe limit?
Safe
of
limit
total
would
calories?
be any. No, I still don't count it on calories, because a calorie is not a calorie. Every calorie is going to
Any
be
percentage of calories. What percentage of calories should be from protein?
from protein in a typical low carb diet, is what you're saying?
Yeah.
About 50%.
50% of the total calories should be from protein.
Protein. Keep your carbs very, very less, minimal.
Okay.
Okay, increase. Now it also depends on your workout intensity. If you are doing a heavy, intense workout, even up to 1.5 grams per body weight is not a problem.
I came across one lecture and they are saying now absolute recommendation 1.5 gram per kilogram. So
correct.
Round about 100 gram divided in 3 meals. Is it right?
3 meals, yes, absolutely.
Right. Good. Yes, Dhiren.
Yeah. So now we come to the most important point, and that's the practical application of the low carb diet. So let's take a 3 type of people. If you look at the society, we can divide them broadly into 3 categories. The first category is a vegetarian category. Then there is a small group of vegetarians who are really not taking any animal product, and we call it vegan. So that's a small group of the vegetarian. And then we have another broad category is a non-vegetarian. So now let us understand one by one. So let's start with the most difficult one, where it is very difficult to go for a low carb diet. That's a vegan group. Then we will go to the vegetarian group. And the last we will take the non-vegetarian group, where there are a lot of options for low carb or the non-carb meals. So let's start with if you have a customer or a client who is vegan and he or she wants to go for low carb diet, what are the options available to them?
To be honest, sir, I don't recommend anything to vegans because I have never taken them up. I've had several come to me, and my only advice to them is please start eating eggs. So I'm being very honest on your show, but this is something because I don't have anything to give them, really, literally nothing. I see a lot of deficiency in their markers, B12, D3s. So all I can say is I just wish them well, because I really don't have anything to design for them. Literally. Coming to the vegetarians, again, the ones who are eating fish, the pescatarians, yes, you have a great source of omega-3. So for them, they can always include things like berries, maybe some walnuts, paneer, fish, broccoli, hung curds. There's a variety of options for them. Then again, there is lacto-vegetarians who are eating eggs and dairy. So they have another vast variety. See, what happens is with eggs, you get all the nutrition. Plus, you have all the essential vitamins and minerals. So for a vegetarian who is eating eggs, I think it's a great win-win situation. Okay. Coming to non-vegetarian, the options are unlimited, literally. It's always eggs, chicken, fish, meat. Some people do love organ meat also. So these are foods which will keep them fuller on a low carb diet, of course. And when they're increasing these fats and proteins, they are considerably reducing their carbohydrate intake on the plate. So it's not that something has to be done deliberately. You don't have to remove, like I tell people, don't remove the carbohydrates, replace it. So the replacing does a better job because it will give you fullness. You won't be starving. So a lot of people, think that a low carb diet simply means starvation, or intermittent fasting means starvation. No. What we do is, because we are eating a good quality of protein and a good quality of fat, exactly what the body requires, the body doesn't keep asking you for food over and over again. Whereas what happens in a high carb diet is you eat foods, your blood sugar will spike. Now the body has to bring that blood sugar back into 70 and 90. So it is going to release insulin over and over to push that sugar in a cell. That high carb eater, that high carb diet is now going to crash. You're going to have a drop in your blood sugar and you're going to be eating again. So that's where this eating every 2 hours concept has started. We are not designed to be eating every 2 hours because the body has many other functions. So when you go on a low carb diet or a lifestyle, you're actually getting freedom from a lot of other problems. You're having more time with your family because you're not constantly thinking of food. You're feeling full. Your two important hormones, that is your leptin and your ghrelin. Your leptin is your satiety hormone, which tells you I'm full. And ghrelin, which is your hunger hormone, which tell you that I'm hungry. These two work in perfect conjunction. So I would like to add this also as another good side effect of being on a low carb diet. Your hormonal balance is maintained.
Okay, coming back to the question regarding the vegetarian, because that's where I am. So basically, I'm a vegetarian, but I don't take fish.
Yes.
And many of my vegetarian friends, they don't even take eggs also.
Correct.
Right. So for that vegetarian group, what are the options available?
Absolutely. So their first to-go option will be always paneer, cottage cheese. That's going to be their first to-go.
Cheese, that's the first option. It gives a good amount of protein and fat.
And fats together. Absolutely.
Yes.
Hung curd is another. Hung curd. We have veggies like your bell pepper, mushrooms, broccoli, cauliflower, walnuts, almonds, all your nuts like your macadamia nuts, pecans. These are great options for vegetarians. And most of my vegetarians who are on a 2 meal a day, who have started with 5 meals a day and come to a 2 meal a day, now introduced intermittent fasting with their meals, and they feel so full. Plus, they have other benefits like good sleep because they're not constantly hungry. They are full with their meals and they sleep well. They exercise on a fasted state. So these are benefits I see for a vegetarian. And I must say this, I salute vegetarians who do this kind of a lifestyle where they include low carb and intermittent fasting together. And most of them show better results than a non-vegetarian.
Okay. Coming to the most common meal which the vegetarian people are taking, mostly from the wheat, that's called a chapati, roti, parotha, khakra, bhakri, a very famous food for Gujarati people. So all these things, they have to cut down, the reason is because all is very high in carbs.
Absolutely. Absolutely. So they are very high in carbs, but how do you modify, how do you moderately remove them? So you, like I said, you start replacing these foods with quality protein. So if somebody is taking, let's say, 2 parathas, you cannot tell them to instantly remove both the parathas of the meal. So you always tell them to probably mix it with maybe little bit of coconut flour or almond flour. These are good options where you can replace high carb grains, high carb wheat with these kind of options. So coconut flour, almond flour works great with them, low on glycemic index, and of course gives them a lot of fullness. The other thing, like I said, include more of fats. The higher your fat content on the plate or in your cooking mediums, the lower your dependency on carb. Even cauliflower rice, broccoli rice. So these are other options. They are also a part of the keto lifestyle where you can opt for these things instead of white rice or instead of brown rice.
Okay. Then coming to the few options which I got a question just now, and the question is about the jaw, the ragi, jowar,
Yeah.
bajra.
Yes.
So all what we call it grains, but not the wheat. So what do you recommend? Is it good or that is not good?
Again, it depends on the severity of the problems of the metabolic issues. So if you're including a little bit of jawar or a little bit of ragi, that's absolutely not a problem. You can, but try to minimize it. Also try to keep it in the daytime where the activity levels are much higher, not during the last meal or the post sunset meal, so that your sugar spikes don't keep affecting your sleep in the night.
Okay, right. Yeah, Colonel, please.
Yeah, different diets and different recommendation very well explained. But basic question for a beginner, if we want to start on low carbohydrate diet, how one can calculate carbohydrate content in their food? If anyone can choose his or her own meal without expert advice and plan their meal, or they have to take expert advice? And is there any book or app you suggest to beginners?
Yes, absolutely. So to calculate your carb content, I would say a good range for people who are exercising would be anywhere between 100 to 150 grams.
Right. That's a total recommendation. But
Yes.
My question was that how to calculate carbohydrate content of each meal portions. Say from roti, how one can get, how much carbohydrate one is getting. From dal, how much carbohydrate one is getting. For a lay person,
Yes.
is it possible to calculate carbohydrate content of the meal?
Absolutely. We do everything on Google these days. So
Right.
if you actually type a macro content of a product, of a food, you will have the net carbs, the fiber, the protein, the fat.
Right. That these apps are reliable.
Absolutely.
Absolutely reliable.
Yes,
One should
and
start.
then there are a lot of books. I will share a couple of books which will give you the guidelines of how to distribute your carb, protein, and fat content.
Right. So like initial carbohydrate should be between 100 to 150 gram. So
Yes, that
you
is if you're
recommending,
exercising.
right. If a person
If you
is
want to go lower, you can go lower to 50, between 50 to 100 also.
right. This recommendation in to obese person. If a person
Yes,
is
even to a diabetic.
even to diabetic and normal weight person.
Absolutely. Absolutely.
Right. So if one start on 100 to 150 gram of carbohydrate, is there any initial hiccups or I mean difficulties one can face in the initial period? And what are they?
Hiccups are going to be cravings, a lot of cravings, because obviously the blood sugars are constantly spiking up and down. Body is constantly asking for glucose from outside. So fat adaptation or using your own stored body fat is going to take a while. So hence, I always recommend people who start on a low carb is to maintain 3 meals in a day. Do not try to jump to a 16-8 intermittent fasting on day 1 of low carb.
50 gram of carbohydrate in each meal. That is the normal recommendation.
Normal recommendation.
3 meals, right? And
if you're
100.
doing.
decrease in carbohydrate should be accompanied by increase in protein intake simultaneously, or first we have to reduce carbohydrate, then we have to increase the protein intake?
No, sir. It will be increase in the fat content because you're
Increase in
using
fat
one
content.
source of energy.
Okay.
So if the body is not using
carbohydrate should
glucose,
be balanced against fat, not against protein. Protein is a constant measure.
absolutely. Yes, protein stays there.
Right. So about 100 grams of protein should be there, about 25%
Yes.
of the total calorie.
Absolutely.
Right.
Absolutely.
And
if you want to go in the ketosis state, then you can drop it between 20 to 50 grams.
at what stage you decide this person should go for keto diet and not only low carb diet? Any other, guidelines or reports you are saying by? Is there any indication that this person is not responding to my low carbohydrate diet? I should recommend him or her keto diet. At what stage you think like that?
I would give it about 3 months.
3
to
months.
see how the person responds to a low carb diet. 99% they will respond.
They will respond. And this should be a lifelong measure, or one should go back to their original diet after, goals are achieved, like weight reduction or diabetes remission?
So it's very simple. If you go back to the old ways of eating, you're going to get back the old problems again.
Okay, so this should be a lifelong measure.
Absolutely. We are a human being, a human system. We are designed to eat a certain way. So if you just maintain that certain biological system of eating, you will always be in good shape, in good health markers, and in good body weight.
What you are going to follow for your life, that only you should start.
Exactly. And that is one of the reasons I always recommend to people, please don't go with all these fancy products that are available in the market. Keto products, keto foods, keto prefixed foods. There are a lot of companies who are supplying you with these keto meals because they will not be sustainable. Firstly. Secondly, they are doing it for a business. So anything that you can do at home is always more sustainable, because you have to also keep in mind you have a family to live with.
Right, good. Dhiren, your question.
Yeah, we have got a question. The question is about two things. You mentioned about the lot of nuts. They are the fancy nuts. The question is about the simple peanut. Is it good? And the
Peanut
second
will
is about the
still
chana.
be high. Chana is great, not a problem. Yes, so if you're a vegetarian, low carb, absolutely both of these can be taken. But I don't see, sir, why almonds and walnuts would be fancy nuts.
Okay, good. Yeah, but they are a bit expensive than the peanuts.
Yes, absolutely. But peanuts, you have to be a little more careful because of the omega-3, omega-6 ratios.
Does peanuts cause leaky gut? I read somewhere.
Yes, I had read it to myself. I don't have enough information on that area, but
only persons allergic to peanuts may manifest the symptoms of leaky gut. It's like that?
Yes, yes. Also, if he's already had a leaky gut, it probably will get it worse.
Okay.
Okay, then there is a question from the audience, and that question is about that I am a sweet tooth person. So what about the sugar substitutes?
Sugar substitute. So what happens? So we don't actually have a sweet tooth. Many a times, we misunderstand this sweet tooth as a I would say the less of salts in your food. So if you're low on salt, like the recommendation keeps saying, keep taking low salt for blood pressure. But it's not the salt. The salt intake is not a problem. The salt retention is a problem in our bodies. So coming to sweet tooth, many a times we misunderstand this sweet craving for actually our salt intake, which is very less. So one recommendation I give to most of my trainees is salt water. And many, in fact, 3 of my salt and water. A pinch of salt, pinch of pink salt or sea salt in a glass of water. Try this for about a few days and you will have no sugar cravings absolutely at all.
Okay, so that's for the sugar part.
Also, the other option that one could try, and I would recommend, is dark chocolate. Anything above 85% would help.
Okay, so that was a question again from the same person. I don't know how did you get that question, because I got it on the WhatsApp. But the question is like, I usually have a 1 chocolate after food. The question is about 1 chocolate. It always depends on the size of the chocolate.
Portion size.
The portion size. That's very important. I think that there is a dark chocolate available which is really low in sugar. And
Dark is 55. Amul is having dark chocolate as well
No,
as
sir.
bitter chocolate. Bitter chocolate
Yes.
also.
So
bitter, yeah.
yes. So Amul is always recommended by me because I always look at the sugar content, and I know people fall for the fancy Lindt chocolate, which I never recommend. It has almost 7 grams of sugar. But if you look at the dark chocolate of Amul, which is 99% cacao,
That
the
we
latest
can't,
one.
our tongue say no to it.
I know.
I can
know.
tolerate up to 75%. I am
Yeah.
taking
So
regularly.
how I tell people to transform there is by mixing 75 and 85 a little bit together.
Okay. My daughter is having dark chocolate, that is 55%, and I am having bitter chocolate,
Okay, that
that
is
is
not even
75%.
dark chocolate.
Right.
That's fine.
Okay, then there is another very important question, and I'm sure that this person is either a Gujarati or probably from the southern India. What is the substitute of rice? Because rice is full
Our
of carbs.
staple. Yeah.
Yeah.
Cauliflower rice, broccoli rice.
So basically, you are suggesting adding vegetables in the rice so that the peak
No,
of
sir. Absolutely not. I'm suggesting cauliflower rice. So if somebody wants this recipe, even if your viewer wants this recipe, it is all over YouTube. It's called as cauli rice, low carb cauli rice. So what we do is we basically shave the cauliflower after boiling it, and when you shave it off in a scraper, it actually becomes and looks like rice. And then you saute this with ghee or with whatever additions you want to, condiments you want to add to it. And I have also shared this recipe on my own YouTube channel because when I was doing low carb and keto, I was sharing these recipes, making them at home, and I was sharing the recipes on my channel so that my clients could benefit from it.
Okay, then there is a question about the soya chunk. So how good the soya chunk is about, is it a low carb diet or it is not?
It's not, sir. It's an endocrine disruptor. I see a lot of women coming to me with hormonal imbalances, with estrogen levels dysregulated. I have a lot of men who have come with man boobs, having a lot of yes, gynecomastia and endocrine hormonal imbalances. And soya is not even protein, to be honest. So if you really have to depend on good source of protein, it's always paneer first.
Then what about the tofu? Then if you are not recommending soya, then tofu is also from the soya. So
same thing.
Same thing. Okay. Yeah. Right. Okay. Fine. Now, just to convince our audience, can you tell us about any success story of your clients who has really benefited from low carb diet?
Absolutely, sir. 99% everybody has. Starting from my own family. So my husband himself, I'll start with him. He has had acidity for almost 40 years. He's had to take an antacid with every single meal that he has consumed for the last 40 years. In the last 3 years that we've changed his diet, he has got zero acidity, absolutely zero acidity. He started off on a low carb diet. He's lost about 18 kgs. He used to have anal bleeding, which has completely stopped now. Absolutely nothing. Coming to my clients, yes, I have a variety of them, starting from as young as 16-year-old to as old as an 80-year-old. Okay. The benefits are vast. Like I said, good health, very good markers. Their vitamin deficiencies got repaired. They had good B12 markers now. They have good D3 markers. And this is what I'm talking to you about is vegetarian clients, not the non-vegetarian clients. So really good progress. Thyroid patients who used to take thyroxine 100 mcg have come down to 25 mcg. And I'm hoping that they will get off it very soon. In terms of sleep apnea, I have 3 patients who no more take a machine while they are sleeping. They have dropped their uric acid from almost 9 to 5. So a lot of success stories. I have always shared them on my YouTube. I've shared them on my Instagram also. And I always share them with the reports so everybody can see what the numbers are showing and what the markers have proved.
Yes, some of the books on the low carb diet, they recommend migraine as one of the indication. Have you come across in your practice that?
Yes, sir. I have three of my trainees who had severe migraines. In fact, two of them used to always be on injections, Bovran. And one of them has already gotten off those injections. The other trainee who was having severe migraines, especially when she wouldn't take a meal for hours, and then she would just have to stay hungry for days because she had such severe migraine that she could not consume any food. Since I cut off the wheat, especially the wheat from her diet and the milk products, she has seen a vast difference. She now runs marathons, empty stomach, on a fasted state, using stored fats, and she's having a very nice lifestyle of keto where she's increased her fat percentage in the food, and that's really helping her to build her endurance on her marathons also.
Okay, so before we come to the question about the exercise and the marathon running, there is a audience question we will take, because otherwise like we may miss that question. And that question is again a very common question about millet diet. So millets has been popularized now by Indian government as an Indian grain. So how do you look at millet in this low carb movement?
Same thing, sir. I don't recommend millets.
Why?
Sugar spikes, glycemic index, same problem. See, the problem is not about taking a carb-rich food. The problem is we're constantly spiking insulin over and over and over again. So high blood sugar is not the problem. High insulin is the problem.
Right. Okay.
If people only understand this and reduce this carb intake, grain is after all a grain. It's going to convert to sugar through any form.
Right. Yeah.
Okay, another term here is moderation. Everybody says eat everything in moderation. But my question is, who decides the term moderation? For you, maybe 2 rotis is moderation. For me, it probably is 4. And remember, high carb foods are always going to keep you hungry over and over again because blood sugar spikes and it falls. So the concept still remains the same.
For Gujaratis, stopping rotis and parathas is very difficult. We
Sir,
can stop
I am
rice.
a born Gujarati. I am a born Gujarati from Kutch.
So you have stopped eating rotis, parathas, rice, everything.
Sir, I haven't eaten it in the last 5 years.
You have become carnivore, so you say it right. Only veggies and carnivore.
Only meat and eggs.
Only meat and eggs. How many eggs you are eating per day?
14.
How much?
1/4.
1/4, sir. Whole eggs.
All with egg yolks.
All with egg yolks.
Oh, great.
My 15-year-old daughter eats 5 whole eggs.
Since about 3 to 4 years, you are eating
3.5, yes, sir. Yes, sir. 3.5 years.
And no abnormal lipid parameters.
What about the LDL?
Absolutely no, sir. LDL is fabulous. So LDL is, like I said, it's a very big chapter. How do we indicate if we have good cholesterol or no? It's always with triglycerides and HDL. If you divide your triglyceride with HDL, you will get a number, and that number should be below 1.5. So if you are under 1.5, it means your LDL is doing its job of transporting your triglycerides to all the cells in the body. We have always misunderstood or not been able to understand how to read our cholesterol report.
And
no,
you have observed
before that, we would like to understand, or we would like to know about your triglyceride and HDL ratio. So what is that ratio?
It's the last I did it, sir, was 0.79. But this was about a year back. I haven't done it since then.
So your triglyceride was lower than HDL?
No. The ratio, triglyceride to HDL ratio is under 1.
Less.
It's under 1, yes.
Yeah, my triglyceride is also less than my HDL. I'm having HDL 60 or 62 and triglycerides 48.
Yeah, so for a male, I would say above 60. For a female, would be above 70.
And
HDL.
one related question. Does low carbohydrate diet in long term, detrimental effect on this lipid metabolism, LDL, just on investigation point of view? Have you come across increase in LDL after low carbohydrate diet for longer period?
Absolutely. Yes, absolutely. LDL is going to increase because it is doing the job of transportation of triglyceride. No? So you'll always keep seeing LDL more in the bloodstream.
But you should not worry about that.
Absolutely not. Within a period of 3 to 4 months, that LDL will drop.
Okay.
It comes to baseline. It's not a problem at all. And this has been written and stated, and I'll give you the book also.
Low carbohydrate living.
Okay, the art and science of low carb diet, low carbohydrate living. Yes.
Living, yeah.
Okay, then coming to another important question, we are coming to the end and only last few minutes. That's about, we would like to understand the role of exercise along with this. You mentioned that, with the nutrition. So basically you said that intermittent fasting you add on after you start the low carb diet. So you don't start everything together. So you start initially with low carb diet and then you add the
intermittent
fasting. What about the exercise?
Absolutely. So exercise is a must
to your clients.
So exercise absolutely is a must. Like I said, motion is lotion. You have to keep moving. So exercise benefits in a lot of ways. Of course, it will give you good sleep. It will help you build muscle. So the more muscles you have, the more space for glycogen. Right? Now coming to nutrition and exercise, without nutrition, your exercise is going to be futile, no use. Because what you're eating is not of good quality. Hence, in your repair period, post-exercise, recovery period, you won't be able to use that fuel because it's of no use. So it just gets converted into your bad fat. At the same time, when you are taking very good nutrition, but you are not showing movement, you are being sedentary, your food is simply wasted because it sits outside your cells. There is no damage that's happened to your cells in terms of exercise, and hence those cells are not able to absorb this food. So always exercise and food is conjunction. And equally important is both.
Yeah. How much exercise do you recommend to your patient? Yeah, everyone has a different tolerance. But
everyone has a different tolerance. Everyone has a different surrounding where they can work out. So some will only be able to do yoga and swimming. Some can only do, let's say, 10,000 steps a day. And there are some who are strength training 3 to 4 times a week. So it all depends on what their particular home surrounding or their schedule is for that time. But exercise is a must. It's a non-negotiable thing. Coming to intermittent fasting, I tell this to people. If you are a beginner, please don't jump into intermittent fasting. Start it very slowly. First, learn to change the quality of your food on your plate. So all your 3 meals, assess your quality of the food. When you do that, that food plate will decide how hungry you will be on the next meal. And many a times you will notice if you have eaten a meal and let's say within 2 to 3 hours, you're hungry again. I always tell people, go back, rewind, see what you had eaten in your last meal. That will tell you where you went wrong. So intermittent fasting is just a time restricted feeding window. It is not something you are intentionally doing. It will only happen when your body is receiving the good quality of foods. Once it receives that good quality of foods, it will not keep asking you for food over and over again. And that is the real intermittent fast.
Okay, coming to the last point of discussion is we discussed something about the marathon runner. You mentioned about the marathon runners. Now, as I understand, the traditional concept is that if you are going for a half marathon or a full marathon, you will need a lot of amount of glucose. And that glucose is only, the source is glycogen. So the glycogen in the liver and the glycogen which is stored in the muscle is going to give you calories or the glucose when you are running. And based on that, there was a notion that if you are going to run a marathon next day morning, then on a previous day night, you need to go for a
carb load.
Carb load in the form of eating pastas or bananas or something like that. So when person is on a low carb diet, loading the body with high carb diet is out of question.
Absolutely. And I have live examples of this, sir.
Yeah. So what happens to your clients who are going for running or a marathon running like that?
So the better source of fuel for a marathon is still going to be fats. Okay. So what we do is I actually help them to become fat adapted. So first they go into a low carb lifestyle. I take them into a little of the high fat keto diet. And once their body gets fat adapted, they have been running marathons on fasted state. And I have testimonials which they have stated and sent me, where they have mentioned that they have not taken any glucose, any sugary beverages throughout the run, just simple water and salt. And it has kept them good through the entire run. I have not just one, I have almost 7 of such marathon runners who have become very beautifully fat adapted. And let me tell you one more thing. Out of these 7, 3 came to me as full-blown diabetics.
Okay. So basically the point is that it's not necessary to load your
Absolutely
body.
not. If you switch the body's fuel source from glucose to burning fat as fuel, your body will be very happy and it will run for a longer period of time.
Okay, so like 1 hour is almost is over, and we really learn a lot of things about the low carb diet. And
thank you, sir.
Really brought a lot of clarity. And the first important message, the 2 message which you really gave it wonderfully well, I would like to repeat that don't jump with the intermittent fasting to begin with. Start with 3 meals without in between anything, 3 meals in a day.
No snacking.
No snacking in between. And once you are like say 2 months, 3 months with that, then you omit 1 meal and go for a like 8-hour window of eating and 16-hour fasting. That should be
that is your magical window. 16/8 is the magical window.
Right. And the long term, at least you have a 3 years experience of intermittent fasting, or you are in which?
So 5 years of intermittent.
5 years of intermittent fasting, and probably that has not any bad effect on your body. So that
absolutely.
Is also, so that's a very important thing, that we really need to come out of the myths that intermittent fasting is really bad for our body, or low carb diet is not. A lot of people, they say that you cannot sustain on low carb diet for a long, but at least you are a real good example that you are on that low carb diet for last 5 years.
Yes, sir.
And intermittent fasting. So really, thank you very much, Mahek and Dr. Pranav, for joining us and sharing your experience with our audience.
Thank you. Sir, I'll just share both the books with your audience.
Please show them. Yeah.
So one is this one.
Yeah, that's a Jason Funk's The Diabetes Code.
And I already showed you this one.
Yeah.
And the third one is
right.
Jeff Wallach and Stephen Finney.
Right. Yeah.
Art and Science of Low Carbohydrate Performance.
So these are really a good reading material to begin with the low carb diet philosophy. So thank you once again for sharing your vast experience with our audience. And we really learned a lot of things. And I'm sure that after 1 or 2 months, we will again have a more session with a very deeper interaction on the subject.
I'm always open to any of the topics that you want me to discuss, sir, anytime. Thank you.
Yeah, thank you.
Thank you so much, Mike. Thank you.
Bye-bye.